Hi, my name is Mariana Ceccaricci, and I decided to do postpartum depression for my project in my paper. What is postpartum depression? Postpartum depression is a mental health disorder that affects women after giving birth. There's a 4-week time frame that is usually the threshold for identifying the onset of postpartum depression. This mental health disorder affects both the mother and the infant. It's also important to note that different things like family history and previous history with psychiatric illnesses and even events during pregnancy can all lead to the onset of postpartum depression. Now let's look at the biological perspective of PPD. All mothers that give birth have a decline in estrogen. This is more specific with women who decide to breastfeed, but all mothers who give birth do have this decline in estrogen. This can lead to different symptoms but the main one is a decline in mood. But there has been the first postpartum depression pill that was approved by the FDA, and this is the second drug overall approved, but the other one, it's called Brexalone, and this requires a hospital stay. But this new pill only requires you to take it at home for 2 weeks. So there has been a rise in popularity for that. After giving birth, there's also a depletion of analgesic antidepressant neurosteroids. So this can lead to also a bigger decline in mood and making it more likely for women to develop things like PPD. And lastly, there are many complications due to a geriatric pregnancy. A geriatric pregnancy is when a woman is 35 years or older when she gives birth. So it is found that due to age as well can also be a factor. But to conclude, after women give birth, there is a lack of many vital hormones that can lead to things like PPD. Next, let's look at the social perspective. So in many countries, there is still a stigma surrounding postpartum depression. This stigma, it is shameful, and it is supposed to make the woman feel bad for having these feelings after giving birth. To most people and some families, they think that having a baby and giving birth is the most joyful thing you can do in life, which, though true for many, it can still be a traumatizing experience for mothers to adapt to this new stage in their life, as well as giving birth. And even though 15% of all new mothers experience postpartum depression, this stigma, unfortunately, has still stuck. For example, there was a cross-sectional study done in Palestine territory. There was a total of 745 telephone-based interviews with mothers 2 to 4 weeks post-childbirth. Their findings that 12.6% of Palestinian mothers were experiencing postpartum depression. And for mothers that lived in the Gaza Strip, this percentage increased. This is due to social and political factors in the area and a lack of social support for the women there. It is also found that women who give birth in the winter are more likely to develop postpartum depression. And we hear of seasonal depression and how that is more common in the winter. And this is kind of similar, and it just goes to show how a mother's environment can worsen symptoms of PPD. Overall, mothers' experience of postpartum depression with a lack of social support and conditions can alleviate different symptoms of PPD. Next, let's look at the psychological perspective. Women suffering with postpartum depression often experience negative thought patterns post-birth. Negative thought patterns are usually aligned with a predisposition of another mental illness. So this is common for lots of women who have experienced a mental illness before giving birth. These negative thought patterns are usually based on the cognitive load of the mother, because the cognitive load is much higher than it would be due to aspects like injury during birth, high-risk pregnancy experience, or difficulty with labor. It's also important to note that struggles with bonding can worsen the symptoms of PPD. The lack of bonding can be caused by the mother having maternal insecure attachment, which is based on the mother's own model of attachment, based on her own personal experiences, and the way she experienced childhood, and how, for first-time moms, this can also be hard because it's their first time doing this. And lastly, most mothers lack social support, especially in cases of single moms, which can further have negative effects of PPD. Next, the history of postpartum depression. So it was not till 1994 that postpartum depression was added to the DSM, but postpartum depression dates back much further than that. In 700 BC, it was said that women were described as having emotional difficulties post-birth, and this is where the term baby blues was coined. And they said that women's symptoms included depressed mood, lack of interest, weight changes, feelings of guilt, and worthlessness. So, to conclude with that, postpartum depression has always existed. There has just been a lack of awareness for it in society. Limitations to different postpartum depression studies is there is a lack of control groups in a lot of these studies. Postpartum depression is very underreported due to the stigma and the lack of resources for it. And lastly, postpartum depression can often get confused with major depressive disorder, so this can lead to even more underreporting. And then the implications of COVID-19 on postpartum depression are, there was a study done, and it found that women were scoring higher on the Edinburgh's postnatal depression score if they had experienced any symptoms of COVID-19. It had severely increased their score. It's also important to note that the lack of social support during lockdown and the very limited childcare options during lockdown can also worsen symptoms of PPD. Next is future directions. Cognitive and interpersonal support therapies are very beneficial for women experiencing PPD. Psychosocial support through groups and complementary therapies are also very helpful. Next, exercise can help alleviate symptoms of PPD. 30 minutes of moderate intensity activity performed 3 to 5 times per week for 4 to 5 months can have alleviate a lot of symptoms of PPD, and having a support system that can have long-term effects on mothers and infants and really help alleviate this mother's symptoms of PPD. And then here are my references I used throughout. Thank you.